I do hope we have some providers listening who might see that gestational diabetes exists on a spectrum and consider more closely looking at your client's blood sugar management and looking at the full clinical picture instead of just seeing, oh, gestational diabetes, high risk, all these interventions. That isn't always necessary. In fact, the women that we're seeing, I used to work at a very high risk perinatology office. Most of our ladies delivered at Harbor UCLA Medical Center in Los Angeles. And we were so good at our gestational diabetes management, especially when we started using my nutrition protocol, which was lower carb, more protein. We had way less insulin and medication, but also their babies did not look like what the hospital thought of an infant of a diabetic mother, IDM, as they call it in the research. They were like, I think you're misdiagnosing these ladies because we're not having neonatal hypoglycemia. The babies are not larger than average. What are you guys doing over there? Because these aren't diabetic babies. And so I want to share that for any clinicians listening, especially those who are in charge of determining birth choices and birth outcomes, that it really has everything to do with blood sugar control during the pregnancy, not just whether there's a diagnosis or not a diagnosis.